Good morning, everybody. So today our next topic of discussion is the pathology and the surgical aspect of the stomach. So first disease is the congenital hypertrophic of the pyloric stenosis. So pyloric antrum is present here. So there is a pyloric valve. And if there is a stenosis of this pyloric valve congenitally, then it causes a hypertrophic pyloric stenosis. Hypertrophic means the excessive cell division, excessive increase of the cell size and the cell number of the muscles. So there is a congenital hypertrophic pyloric stenosis. So there is a stenosis or narrowing of the pyloric canal. It is seen as an incidence of 3 in 1000 live birth. Male is more predominant than female in a ratio of 4:1. It has a familial predisposition also. It is mainly seen in the white and black, and erythromycin is one of the drug which causes the risk factor. So what will be the clinical features of the patient? The patient will complain of gastric outlet syndrome. So patient will complain of gastric outlet syndrome, a non-bilious projectile vomiting because the food cannot reach to the duodenum, so no bile is there, so food will project out, the acidic food will project out as a vomitus, so non-biliary vomitus is seen. And 3 to 8 weeks after birth it is seen the stomach is empty, the baby is hungry, but there is no protein energy malnutrition because the food he or she is taking, it is already been absorbed in the stomach, the maximum is absorbed in the stomach and rest are exit out as a vomitus, so no protein energy malnutrition. On examination, we'll see there is olive shaped lump or a pulsatile wave which is from the left side to right side. So what is the investigation of the choice? It is X-ray. A single bubble sign is seen in the X-ray. And secondly, on examination, there is you have to do USG. USG the length is greater than 6 millimeter and the width is greater than 4 millimeter, and in the USG we'll also see there is an empty stomach, there is a cervix sign and antral nipple sign. So these are seen in the USG. So what is the treatment? And another investigation we have to do is the fluoroscopy. Mushroom sign, string sign and caterpillar sign is seen. So what is the treatment? Treatment is either we have to do a medicine treatment with atropine and we have to give n by 2 concentration of 0.45 normal saline solution with 2.5% dextrose and the KCl because there is a electrolytic disbalance. So potassium is less, chloride is less, metabolic alkalosis is there, paradoxical aciduria is there. So we have to manage this by n by 2 concentration of 0.45% of normal saline with 2.5% of dextrose and potassium chloride. We can also use Ringal lactate solution having the electrolyte of sodium 130 milliequivalent per liter, potassium 4 milliequivalent per liter and chloride 100 milliequivalent per liter. Now the surgical management is Ramstead pyloromyotomy. So muscles are splitted because there is a hypertrophy of the muscles. So muscles are splitted by giving the incision. So pyloromyotomy, Ramstead pyloromyotomy. Now coming to gastric volvulus. So gastric volvulus is one of the condition in which there is a torsion of the rotation of the stomach. So this rotation can be organoaxial rotation or mesenterico-axial rotation. So what is organoaxial rotation? So it will rotate in its own axis. Suppose this is the fundus, this is the pylorus, so it will rotate on its own axis. And what is the mesenterico-axial rotation? It is rotate along its mesentery like this, along its mesentery. So organoaxial rotation is most common and it is mainly seen in the elderly person. Mesenterico-axial rotation is, that is anterior-posterior rotation, is mainly seen in the children. So what will be the clinical features? There is a Borchardt triad. What is the Borchardt triad? It tells that There will be epigastric pain, inability to pass the Ryle's tube or nasogastric tube because there is a volvulus, so nasogastric tube will not enter, and the retching without vomiting. So retching will be there without vomiting, which is a ineffective vomiting will be there because there is a volvulus, the vomiting will be ineffective. So we have to do barium meal. Barium meal, we'll see the cup and spill sign or a cascade sign. Cup and spill sign or a cascade sign. What is the treatment? Exploratory laparotomy to be done. To disrotate and then the gastropexy to be done. So this is all about gastric volvulus. Rapunzel syndrome is one of the syndrome where the person eat hair. So we will find hair or the trichiasis in the gastric lumen.